Hi, my beautiful people. How are you guys doing? Happy Saturday, happy weekend. I hope everyone is doing okay, and I hope you guys have been enjoying my videos. So today I'm gonna be talking about high blood pressure. I'm gonna be going deeper into the condition high blood pressure. And the reason why I want to do this is because I found out that high blood pressure can be very difficult to manage. And this is the reason why a lot of people don't know about the pathophysiology of high blood pressure. They don't know what's going on in the body. They don't know which organ is involved. And for me, who is a very visual learner, I want to work with I usually like working with my hands. I want to see what I'm learning about. I want to see what it looks like. If you're able to learn or understand this part of physiology, and you've been finding it difficult or it's been a challenge managing high blood pressure, this video is gonna help you a lot. It's gonna be in 2 or 3 parts, so I advise you, or I recommend that you watch the whole parts. Okay. So I have found out that with patients, or let's look at it this way. I have seen patients in acute care setting, like in the hospital. They come in with uncontrolled high blood pressure, and then they get treated. You hang in the IV, you give them the medication, and then you control the blood pressure in the hospital setting, and then they go back home. Then after some months, they come back again with high blood pressure, with uncontrolled high blood pressure, and you're wondering what's going on. So like usually in acute care in the hospital, these patients get treated and you release them. Yeah, I know some nurses will teach about diet or hand you pamphlets and they go home, and then they come back after. But I have been privileged to work with these patients in their homes. I have seen a patient, like I'll give you a very brief scenario. So I go into a patient home, I check the blood pressure, and it's high. And I ask the patient, it's your blood pressure always this high, or it's stable, or it goes up and down? Some of them will say, yeah, it's not controlled, and I take my medications. I take all my medications regularly, and it's not working. So you know what I find out? So as a nurse practitioner, I'll sit there and then I'll look around the house, and my senses will begin to speak to me. First, I'm gonna see like a can of maybe beer, soda. I'll look on the dining table. I don't see any fruit bowl. All I'm gonna see there like soda. I'll look at on the table. I'll see sugar. I will see processed food on the table, packaged processed food. They open up the fridge, you don't see no vegetables, you don't see no food, like you don't see no homemade food. So most of the food are bought. They buy them from the stores. They don't cook. And then you ask the patient, when last did you cook your own meal? And they're like, oh, I don't have the time to cook. I don't have no one to help me. I order my food. So it's a huge challenge. So now I'm not going to sit down there and say, okay, I'm going to write you another prescription. I'm going to increase the dosage. No, I'm going to right away begin to teach about lifestyle modification. I'm going to sit down there for the next 30 minutes and talk about food, and talk about diet, and talk about how they can get a healthy food. That's what I'm going to sit down there for the next 30 minutes talking to this patient. I'm not going to talk about the medication, because a patient is already taking his or her medications regularly. So I'm going to sit down there and teach about diet, lifestyle modification. So this is why it's so interesting that you watch this video till the end. You watch the part, it could be up to part 3. So, and I hope I'm gonna make it very simple, very simple, so that you can be in the flow. Okay. And so talking about high blood pressure, what is high blood pressure? So the question is, what is high blood pressure? What is hypertension? So for every healthy individual, when your heart, we have our heart, let's say our heart is here, right? Your heart actually contracts, like, look at it this way, like it squeezes, right? When it squeezes, it's supposed to circulate blood or send out blood to your body, to the arteries. You have arteries, you have veins going around your body. So there's pressure in those arteries going around and coming back to your heart, right? So when your heart contracts, squeezes to pump out that blood, the pressure in the blood vessels is supposed to be at 120 when your heart is squeezing that way, right? That's 120. When your heart relaxes, like when your heart relaxes, blood flows in, and the chambers of the heart, the blood begins to fill into the chambers just like a bucket. When you fill in water in a bucket, right? You fill it up. That's like when the heart relaxes. The blood pressure is supposed to be at 80. That's why they say a normal blood pressure is 120 over 80. So when you're pouring the water, like the heart is filling up with blood, your heart is relaxed. Your blood pressure should be at 80 or somewhere below. But if your heart is squeezing, because the heart chambers are filled with enough blood, your heart begins to squeeze so that it can pour out the blood. So think about it, when you have filled up that bucket, the water has to flow out of the bucket. So when the heart is squeezing, the pressure in the vessels or the arteries has to be 120. So what is high blood pressure? When the pressure in the blood vessels is above 120 over 80. It could be above 120 and the bottom, when the heart is relaxed, is normal. That's also high blood pressure. The top number or the bottom number, if it's high, that's called high blood pressure. And you are actually diagnosed as hypertensive when you have checked your blood pressure on 2 separate occasions and they remain elevated, like they're above 120 and the down one above 80. So that's what is called high blood pressure. So over time, when you have sustained high blood pressure, your pressure is above those numbers, above 120 and the bottom one above 80. If it stays elevated over time, that's high blood pressure, and it's in different stages. We have stage 1, we have stage 2, and the higher the stage, the more dangerous. So what happens if you have your blood pressure high over time? And the dangerous thing about high blood pressure is most people feel very normal. You feel very normal. So that's why some people go to the doctor, will check the blood pressure, and will say, oh, have you any history of high blood pressure? They say, no, I don't have no high blood pressure. And then we say, okay, you come back again in 3 months, we'll check it again. Or check at home with your blood pressure. In a week, we'll call you back. If it's still high, we'll have to put you on a blood pressure medication. And then when they do that in a week, we get the readings. We find out that the blood pressure is sustained at a higher number. And some of the patients will be like, I'm not going to take this medication. I don't feel no symptoms. So that's why they call high blood pressure a silent killer. Sometimes you don't feel no symptoms. You don't have no headache, you don't have no dizziness, you don't have no chest pain. You feel normal, you feel fine, energetic. That's why you hear about somebody healthy and suddenly you hear about sudden death. High blood pressure is a major cause of sudden death, like uncontrolled blood pressure. So if your blood pressure is sustained in higher numbers over time, it begins to damage the eye, causes blindness. It can cause kidney failure. It can damage the arteries of the body and cause what we call peripheral neuropathy. You hear about people say, oh, my legs are so hot. Sometimes I feel pinching sensation. That's as a result of uncontrolled blood pressure. So we're going to be talking about the types of hypertension. Basically, we have 2. The first one is secondary hypertension, or the non-essential hypertension. So in that category, that's when we know, or your healthcare provider, or even you know the root cause of high blood pressure, and then the root or the source is treated, and then there's no longer high blood pressure. Like sometimes kidney tumors, some tumors in the part of the body, and sometimes people are on long-term NSAIDs like ibuprofen, can cause high blood pressure. If we find out it's the NSAID, we take it off and your blood pressure it's normalized. Sometimes people who are on long-term steroids also can have high blood pressure. If we find out that's the root cause, when we take the medication away, we find out your blood pressure returns to normal. And we also have people on estrogen, high levels of estrogen. If you are, especially women, if you are on contraceptives, that happened to me. If you're on contraceptives, find out if it has estrogen alone. Find out from your OBGYN if you're on contraceptives. That can also be a root cause of your high blood pressure. Think about it. If you are not having any high blood pressure and then suddenly you went on contraceptive pills and suddenly you begin to feel weird, they check, you get nervous, they check your blood pressure is always elevated, it's that pill because of the high level of estrogen. So that's secondary. So secondary, we know the source, we treat it, right? But for primary or essential high blood pressure, there is no root cause. It's like we're just trying everywhere to know what the cause is. So for primary or essential high blood pressure, that's where I'm going to be talking about, because 95% of people have essential primary high blood pressure. So for primary high blood pressure, primary hypertension, we're going to be looking at the pathophysiology, what's going on in the body. And it's very good you appreciate this pathophysiology, because that way you'll be able to say, so this is where my problem is. Let me give it a try. It could be, so let me give you an example. Let's say smoking. That's one example. It could be, so remember, there are so many risk factors. And what we do here at Upstream is for you to look at these risk factors, and because they are modifiable, what I mean is because they can be changed, because you can do something to change it, you should implement those healthy behaviors. Like smoking is modifiable. You say, okay, I'm gonna do this. Maybe someone out there is saying, oh, Mr. B smoked for 100 years. He lived a healthy life before he died. Remember, these numbers are random numbers. They're random numbers. You don't know where you're falling. So if you know this is a risk factor that can lead to an early death, so why don't you work on stopping that unhealthy behavior? So like I said, smoking, alcohol, heavy alcohol. And then there is one which is very big, is when your brain is involved in causing high blood pressure. So when I say the brain, I'm looking at the nervous system. So in our brain, let me just give you a quick rundown of the pathway of the organs that is involved in controlling high blood pressure. Your brain, we have the lungs, we have the kidney, we have the heart, we have the adrenal gland. All right, and we have all your peripheral arteries, all the arteries around your body coming back, connecting back to the heart. So the heart, I know everybody, when we hear high blood pressure, everybody thinks it's just the heart. No, it's all about the arteries, everything connected to the heart, from the brain to the heart, the lungs to the heart, the kidney to the heart, the liver to the heart. So the reason why the brain is involved, there's one part of essential high blood pressure where we talk about it. If you've heard about stress, when they say, oh, stress makes my blood pressure go up. Okay guys, link to the second part is below this video, so watch the second part in the next video. Okay, thank you.